Someone asked me what clinical interest I had, and my response was helping clinicians get the best out of what they had for patients. Because I think organisational ways of doing things can help or hinder what gets delivered. CCGs came about because we wanted to take the GP-patient relationship to a much bigger level, to a healthcare population level, and so that how we interact as a CCG with our public has got to have a solid foundation of how we as GPs and the healthcare we deliver at a practice level can be bigged up. But it's also wider than that. A number of things that we're trying to do, and in our priorities we've got the diabetes work, and we've worked very hard with our trust clinicians, the specialists in diabetes, the specialist nurses, with our GP practices, to come up with a way of how we can deliver joined up care for a patient who happens to have diabetes. But that also includes how do we get the best education for patients, how do we get them involved in looking after themselves and promoting the self-care angle. And then with the county council there's the elements of, well, what's going to stop people getting diabetes in the future, because the legacy of continuing doing what we're now doing is that we're going to have a much greater proportion of people in Suffolk having diabetes. So what can we do that's going to stop that from growing at the rate that it is? And that means working with our partners around education for children, sport. What can people do to help with their weight, with making healthy choices? So it's actually going the extra mile, not just around what are the clinical aspects of what we're trying to do, but the other aspects of what is a normal life for somebody. We can have all of the best meaning in the world about what we want to do, but unless we've got patients wanting to do it, we're not going to get anywhere. So it's about how we face up to that challenge and use our experience at an individual level to see what we can do even better at the bigger one. We're not here to do an average job. We want to be ambitious as a governing body, as a clinical executive, and we want to pass that inspiration on to the GPs in our membership organisations and to clinicians in the trusts that we're working with, and hopefully inspire our patients and be also inspired by them to deliver the best services.